Hi, this is Dr. Doug Willen. In today's video, we're going to look at adrenal fatigue. Now, if you're the type of person that feels no matter how much you sleep, you go to bed tired and you do not get recharged when you wake up, so you're still tired in the morning, this could be a good video for you. Now, let's go on. I have a bunch of nice slides today. Adrenal fatigue will be the topic. Let's talk a little bit about what the adrenal glands are first. The adrenal glands, also known as suprarenals, are endocrine glands that produce a variety of hormones, including adrenaline and the steroids, aldosterone, and cortisol. They are found above the kidneys. So you have your kidney here like this, and the adrenal glands sit on top. I'll show you a picture in a second. Each gland has an outer cortex, which produces the steroid hormones, and an inner medulla. But let's take a look. We're not going to make this a science class because I really want to go over signs and symptoms so you can start to see if you're a person that is checking a lot of boxes when it comes to signs and symptoms. I'm a clinical nutritionist, a chiropractor here in New York City, and I have been giving patients natural supplements for 20 plus years to not only support all the hormone function naturally, like thyroid, adrenal, natural progesterone cream for women, but adrenal is a biggie, and it's for that stressed out person, and we're going to go over those signs and symptoms in a second. But first, let's take a look to see where the adrenals are in your body. So the kidneys are in the back part of your body. So if you take two fists and reach them behind your back and lift them as high as you can, that's approximately where your kidneys are. And on top of the kidneys is this little gland called the adrenal gland. Let's get another picture. So here we have a little bit of a close-up. So you see the kidneys, you see the little tiny yellow cap on top, and that's the right adrenal gland, and the one on the other side is the left adrenal gland. It might be reverse on your video because I think it's going to hit you with a mirror image of it. So here's a doctor and a patient. The patient is pointing to where they feel pain, possibly kidney pain. Now this is just a stock photograph, so but the doctor's upper hand or right hand, for me it's the right hand, is approximately where that kidney would be. And the adrenal glands, like I said, is just a little bit above it. Now the adrenal glands, some of its day-to-day tasks are to burn fat and protein, so that's really important, regulate sugar, regulate blood pressure, and it's also produces the hormones that allows the body to react to stress. So we have all sorts of stressors that the human body encounters. Some of them are external, some are internal. An external stressor could be something as simple as when you're in cold weather, or if the weather's too hot, or if there's loud noises. Like, have you ever just been around such loud noises for a sustained amount of time that it starts to stress out your body? That would be a stressor. Internal stress could be blood sugar imbalance. It could be being exposed to a bacteria, a virus, a fungus, a disease of any sort. When your body is ill, when it's inflamed, when it's injured, your body is going to react to this because the human organism is now under stress. It's under stress because it's being challenged in its state of homeostasis. Homeostasis means that yin-yang balance that your body would love to be in if given the opportunity. And different stressors push, pull, or tug the body out of that natural state of homeostasis or balance. And any time that that balance is teeter-tottered and disrupted a little bit, the adrenal glands kick in and release hormones, react, release stuff into your bloodstream that starts to signal the brain to hopefully balance it out again. But in the meantime, you can get all sorts of reactions in the body from change in your blood pressure, change in your blood sugar. You might feel your palms sweating. You could feel your heart palpating or responding. You could get that fight or flight reaction where your body, just like the animal that it really is, feels like, do I have to run for my life? Do I have to respond? Do I have to act to this stress in a way that I need to for survival? But what if you're just simply walking down the sidewalk and a big truck comes by and rumbles, and your body reacts so urgently when it didn't really need to go that far, and your body inappropriately gets knocked out of balance. So that's an adrenal stress response that some of us might have experienced in your lives. Some of us might be living in that state on a more of a chronic or permanent basis, and that's what we're going to look at a little bit and how that shows up in your body. So let's look at a few things. I really want to discuss the difference between adrenal fatigue, or the concept of adrenal fatigue, versus Addison disease. Now, Addison disease would be the full-blown adrenal disease. It's often called adrenal insufficiency. So adrenal insufficiency is a medical condition when your adrenal glands aren't producing adequate amounts of one of these more essential hormones. And this is measurable, and you can get a diagnosis. So Addison's disease is the disease of the adrenals, where you can get a medical diagnosis, and adrenal fatigue is a whole list of signs and symptoms that we'll discuss in this video, where you're in a condition of long-term stress that's starting to give you a miniature version of adrenal insufficiency, not enough to show up in your blood work through medical analysis to get you a full-blown diagnosis, but you just live in the state of exhaustion and overwhelm for sometimes decades, and there is something to do. I mentioned that I've been working clinically. I still am in clinical practice, so this is not something that I used to do. I work here in New York City. I've worked with many different adrenal natural supplement products over the years, and there's many good ones out there. A couple of years ago, I made my own formula. It looks like this, and it's not the only formula. It's just the one that I make. I obviously put in all the ingredients that I thought would help my patients the most. At the end, I'll tell you about it, but it'll also be in the description below. But let's move on. There's a lot of stuff to look at. So let's just take a quick look at Addison's, because Addison's is the disease, and that's not adrenal fatigue. So sometimes it's also known as called hypocortisolism, which means that you're making less than the amount of cortisol that you need to make. It's a disorder in which the adrenal glands don't produce enough hormones. Specifically, the adrenal glands produce insufficient amounts of the hormone cortisol. Sometimes the other hormone that the adrenal glands produce, aldosterone, is also insufficient. And when the body's under stress, for example, like I said, fighting an infection, this deficiency of cortisol can result in a life-threatening Addisonian crisis characterized by low blood pressure. So the low blood pressure might be one of the first things you notice. People with low blood pressure, at least within normal, what I call normal range of low blood pressure, they're lying on the couch, they jump up really quick, and they get dizzy. You might feel it that way. And I'm not talking about being, again, in a crisis state, but you might be someone that tends to swing a little bit more towards the lower side. That does not mean you have Addison's, so don't jump to that conclusion. I'm just talking about what it feels like to have lower blood pressure. So again, on Addison's, some of the symptoms tend to be nonspecific and include fatigue, nausea, darkening of the skin, and dizziness upon standing, like I said. Treatment involves taking hormones to replace those not produced by the adrenal glands, and that's that full disease called Addison's. That please seek your medical doctor, get the proper diagnosis, and work directly with your medical doctor if you feel that that is something that is happening for you. Fewer than 200,000 U.S. cases per year, so it would really be in the rare category. Treatment can help, but this condition really can't be cured. It requires a medical diagnosis, lab tests or imaging is always required, and it's chronic. It can last for years. Very often it lasts for a lifetime. Little bit of history. JFK had Addison's disease. He tried to hide it, so when he was inaugurated, he said he was in perfect health. And being the youngest president in history, and I think he still is the youngest president in history, he wanted to have this image of vitalism and be this young, robust, vital president. And he did have this disease, which he kept hidden. So it says here, physicians who treated JFK and examined his body after his death have confirmed that the 35th president had Addison's disease. It was the subject of rumor and disinformation during his lifetime. Just a little note. So let's get into something I'm excited about. I'm excited about helping people with adrenal fatigue because they don't have the full-blown disease. And a lot of the type of clinical work that I've done over the years, and I'm very proud to be in this little bridge area. So if someone has a full-blown disease, maybe that wouldn't be a good patient or client for me because I'm not a crisis doctor. But a lot of people for years bridged the gap of where they used to have optimal health, where they used to feel fantastic all the time, and then they go into that gray area for 1 year, 5 years, 10 years, 20 years before they get a medical diagnosis that could point to a treatment protocol, sometimes a pharmaceutical or a prescription protocol, that they can finally know what it is and diagnose. And the reason I like being a natural doctor, I like working with that patient that does not have that full-blown horrible disease state, but knows something's off. And that's where I can often make a big effect on keeping them well and working on supporting what's working in their body and strengthening the good stuff and not chasing the disease itself. So that might not fit what you look for, but it's something that I've done well. This book came out in 2001. It's written by James L. Wilson. I really love the book. I don't know if I read it in 2001, but I probably read it a year or two after it came out. I have a tattered version both in my office, but today I'm making this from my home, so I don't have it with me. But I love the book, and I'm going to leave a link in the description below where you can get this book if you want to read. But James L. Wilson was at least the first book that I knew of that really took on that adrenal fatigue concept because it's not a disease. And I thought he did a great job on the book. So let's go over some of the signs and symptoms. And these are directly from James L. Wilson's website. And so I'm giving him full credit. And I'm just discussing. He didn't invent the symptoms. They're human symptoms, but he did make a nice list, which I'm going to look at with you. So here it says, my ability to handle stress or pressure is decreased. And we'll often hear patients say that. They feel less productive at work. They seem to have a decrease in cognitive ability. They don't feel that they can think as clearly. They have what I like to call brain fog. My thinking is confused when hurried or under pressure. I tend to avoid emotional situations. So the same person that used to handle all that stuff well doesn't anymore. The person might say, I tend to shake, or I'm nervous when under pressure. I suffer from nervous stomach or indigestion when they get tense. So under stress, their stomach gets wrong. They might have constipation or diarrhea or cramps. And of course, there's many things that could also cause that, like gluten intolerance or celiac disease or parasites or irritable bowel. Understand. But let's go through all these and you start to see if you feel you fit that profile a little bit. And, you know, if profiles and diagnoses and understanding the way we feel was easy, we'd all have it handled and we wouldn't be looking on YouTube or you wouldn't walk into my office one day. So all of this is a journey, it's a process, and fortunately the level that I work at, I'm not at that crisis level, so the formulas that I make are more to build health, build longevity, help you feel better and feel more vital, and they don't harm your body to use that while you're on this journey of looking to see why you might in fact be in crisis if that is your situation. So back to these, I have many unexplained fears and anxieties when you're under this level of stress and if it's being caused by overworked adrenal. See, any gland that overworks eventually can begin to underfunction. And that's what adrenal fatigue is that your adrenals are not up to their normal productivity level. People notice a change in libido. My sex drive is noticeably less than it used to be, as someone might report that in this scenario. They get lightheaded or dizzy when rising rapidly. We said that. And that's because of that tendency to have a lower blood pressure in this condition. They get up quickly from the couch and they feel dizzy. And they have to almost remind themselves, don't get up so quick, when they are jumping up from possibly watching TV or lying down. I have feelings of graying or blacking out. I'm chronically fatigued, feeling unwell more of the time than they do feel well. They notice that they might get ankle swelling. The swelling is worse in the evening. People usually need to lie down and rest after a session of any type of stress. They just feel like they don't have that hardy constitution that they used to. My muscles seem to feel weaker than they should. My hands and legs get restless. They experience meaningless body movements like twitching, a little jerky motions. I've become allergic or have increased frequency, severity, or allergic reactions. When I scratch my skin, a white line, leaves a white line. Small irregular dark spots have appeared on my forehead, face, neck, and shoulders. So there could be a pigmentation change. Few more symptoms here. I sometimes feel weak all over, people report. I have unexplained and frequent headaches. I am frequently cold. I have a decreased tolerance for cold. So when it's cold in the room, you really notice it. And again, we mentioned before, but your blood pressure will have a tendency to run lower than normal. A little bit more here. I think this is the last one with the signs and symptoms. I often become hungry, confused, or shaky when under stress. You can sometimes have a weight loss. I've seen weight gain too under stress. So originally it's weight gain, but then as it progresses and becomes more chronic and more long-term, we might even see weight loss. A feeling of hopelessness and despair, a decreased tolerance to handling stress, where people are getting on your nerves a lot more. You're more irritable, you're more short-tempered. And if you don't notice it, maybe your loved ones, people, friends, and family around you have noticed that you don't have that normal patience for everyone in your space, that you get irritated easily. The lymph nodes in the neck can actually swell. You can actually have nausea or vomiting as well. So this is just an overview. I'll be making more videos that dive a little deeper into the adrenals. It's something that I've worked with clinically and I'm very interested in. If you could imagine, New York City, we all get this reputation as stressed out New Yorkers, which is true. And I'm sure you have plenty of stress where you live as well if you don't live in New York. Again, I make a product for adrenal support. I am proud to tell you that because I have tested it clinically on thousands of patients over the last 20 years. And this is what I give to my patients. This is what I take. Actually, this is the bottle I have in my apartment because I take it because I feel the stress of long hours and a lot of responsibility. So thank you for tuning in. Please subscribe if you like this channel and what we're doing. Leave a comment below and have a great day. Thank you.